Welcome back. Now, Health Minister Joe Phaahla has given more details around the recent government gazette on COVID-19 health regulations. Phaahla says the country has reached a major turning point in the fight against the coronavirus pandemic. Last night, he announced the scrapping of the mandatory mask wearing. He also confirmed that first case of monkeypox is in South Africa. For more details or reaction, let's speak to Bhekisisa Centre for Health Journalism Mia Malan. She's the editor-in-chief there. Mia, thank you very much for your time here on all angles. I just want to start with some of the clues that we saw in terms of this this decision coming. In May, for instance, we saw the numbers go down. And I don't know about Bhekisisa, I know you usually have infographics on our statistics, but slowly the media started doing less and less of letting people know how many are infected, etc.
Yes, Masego, I think the reasons that the minister mentioned for dropping the mask mandate is that we have a decline in cases, but more importantly, what happens after infection is now very different from a year ago, and that is that fewer people fall very ill and go to hospital. And one of the main reasons for that is because most people in South Africa by now have immunity, either through natural infection or vaccination. So we have immunity in our bodies that protect us against, when we get infected, from falling very ill and going to hospital. And what we want to try and do now with COVID, now that it's reaching more of an endemic stage, is that we want to make sure our health system is never overwhelmed and that we can live with it in a way that is possible on the long term.
And, when it comes to, for instance, the number of people that are allowed in a venue, that too is something that we saw coming, right? For the same reasons that we realized that we have actually gotten some type of immunity to fight the virus, even though it continues to mutate.
Yes, so as you may recall, we haven't seen a new variant for a very long time. Since the Omicron variant emerged in November last year, we've only seen sub-variants. So the virus hasn't evolved currently to the stage where it has an entirely new form of it. But the regulations that were announced, as you mentioned, relate to three aspects: masks, gatherings, and entry requirements for South Africa. And what it essentially means with gatherings is, previously, if you wanted to have no limit on the number of people that you wanted to have at a gathering, then there was a vaccination requirement or a negative PCR test, and that has now been dropped. With regards to entering South Africa, previously, you would have had to show a vaccination certificate if you were 12 years or older, or you needed to show a negative PCR or antigen test. And you now no longer have to do that. You can just enter South Africa, regardless of whether you're COVID positive or negative.
And this is obviously positive, of course, for the tourism industry, sporting industry, etc. Finally, they'll be able to make money again. But I just wonder your opinion, Mia, in terms of the difference in how we've been reporting about COVID-19, right? Through the years. Right now, we seem to only be, reporting on it when there's breaking news such as this, etc. Not so much letting people know anymore how many people are still infected, how many are dying in hospital daily. Bhekisisa is different, of course, because health is up your alley and it is your beat. But what have you noticed in terms of how we're reporting differently on COVID-19 now, in terms of how it was when more people were dying and getting infected?
So, of course, when there were very, very high numbers, it is natural for the media to give more attention to it. But what we need to look at, what numbers we give people now, is we need to look at what is important at the moment. Now, the National Institute for Communicable Diseases has said that the number of daily cases are not that important any longer. What we need to look at now and follow is, for instance, is there a new variant, or what is the hospitalization numbers? And actually at Bhekisisa, this week we had daily maps on the number of COVID cases and the number of vaccinations. And we actually stopped with it this week because vaccination numbers don't increase that much any longer. So we can rather report on it, say, every month. rather than every day, because they don't really change so much. And the hospitalization and analysis of that is more important now. It doesn't mean that COVID case numbers are not important at all, because we can use those numbers to assess our own risk of infection. So, for instance, when the numbers are high, you can use those high counts for yourself to decide, are you going to attend large gatherings inside during that time? Are you, for instance, going to wear a mask? Because just because the mask mandate has been dropped doesn't mean that you can't wear a mask any longer. And for instance, in the case of people who are high risk, those are people who are over 50 and people with diseases such as diabetes, or if they're obese, those people may still want to consider wearing masks, because what happens to them after they're infected, in other words, how ill they can fall, is different from people without those conditions. So it doesn't mean that no one is going to wear a mask, but in terms of reporting, I think where we are at now is to look at analysis rather than just reporting daily numbers.
All right. Well, thank you very much for your time here on All Angles. That was Mia Malan. She's the editor-in-chief at the Bhekisisa Centre for Health Journalism.